Good morning. My name is Erica Gabriel, and In Living Color is my comparison analysis on grayscale traditional X-ray images versus colorized X-ray images, and whether or not those images could help to increase the rate of accurate and early pneumonia detection in patients. Pneumonia is the top 10 most deadly disease as marked by the World Health Organization, but it's also highly misdiagnosed uh, because looking at x-rays, sometimes on the initial visit, it's more difficult to see. A lot of that inflammation or liquid in the lungs is hidden out of view of the traditional x-ray. Or pneumonia can also, that lung damage can also mimic other diseases. So a person who has pneumonia could be misdiagnosed as not having pneumonia at all and not giving any treatment, or a person who has a different lung disease or infection could be diagnosed as having pneumonia and be treated as such. And in both cases, their conditions worsen or they spread whatever they have virally to the community. So I started this study to gauge whether or not if images were colorized, it could give radiologists a better and more accurate viewpoint. So on the left, we have a traditional grayscale X-ray, and on the right, we have a colorized X-ray, colorized by the library and repo, Deoldify. X-rays work by taking different shades of black and white images of the inside of the body. So bones, because they have the most calcium, they absorb the most light, making them appear white. Whereas fats and tissues absorb a mid-degree of light and they appear more gray. And lungs, because they are filled with air, absorb little to no light, which makes them appear black. So to the untrained eye, it looks as if you're looking at all sorts of shades of gray. It could be harder to decipher between dark gray and black, whereas in this colorized image on the right, what's the area around the lungs that is in red, and the background pops a lot more, so we're able to see a lot of the masses more accurately. And this is actually the x-ray of a patient with bacterial pneumonia. So the grayscale model was more computationally expensive to compute. The models took on average 30 minutes to an hour to train. Also, the model returned 76 false negatives, meaning that there were 76 patients who had pneumonia, but the model predicted that they did not have pneumonia, versus 9 false positives, meaning that the person did not have pneumonia, but the model predicted that they did. Ideally, having 0 in these categories is better. However, if I had to choose, given the information that we have now, I'd rather push as many of these false negatives to positives as possible, because with a second screening, we are able to see things that we weren't before and increase our chances of catching patients with pneumonia before they go out of the door. For the colorized x-rays, the model performed at 99% accuracy. I'm giving us 0 false negatives and 1 false positive, which is what we like to see. The model correctly classified a little over 3,000 correct x-rays. So going into the EDA, I wanted to know who's more prone to being infected with pneumonia. The census has 9 focus groups for people who are prone to having pneumonia. The top 14 million are white people, and then 2 million African Americans, and then 600,000 or so Native American Indians, and it goes decreases from there. However, as marked by the World Health Organization, about 40 of every 100,000 people of Black men and women are more likely to get pneumonia, which makes them the top prime group of people who are more likely to get it. And then there's Native American Indians and Hispanics and Latinos and so on and so forth. So I got curious about how those surveillance groups were organized. In my previous presentation, I discussed the relationship between pneumonia and COVID-19, being that 44% of those who died from COVID-19 had pneumonia, and pneumonia is proven to be a long-term effect of COVID-19. So looking at the COVID-19 cases and hospitalization by death and death by race and ethnicity, American Indians and Alaska Natives are most likely to have cases and have the highest rate of hospitalization, whereas Black or African Americans have the highest death rates from COVID-19. When it comes to pneumonia and COVID-19 vaccination coverage compared to their white counterparts, minorities are only 2% likely to be offered a vaccine versus 20% of their white peers. And when I dove into this a little further, it turns out that African Americans are most likely to refuse treatment or not participate in clinical trials. That could be to their benefit. So obviously I wanted to know why. Well, why are African Americans more likely to refuse medical treatment? And historically, African Americans have been subjected to non-consensual and non-beneficial medical practices, and also unethical medical practices as well, starting from the Mississippi appendectomies, where impoverished Black women from the South from the 1920s to the 1980s were told that they needed their appendix removed, and they were actually sterilized without their consent. Also, the Columbia University and New York Psychiatric Institute study from 1992 to 1997, pressuring Black moms that if their older son was a juvenile delinquent, that their younger son would have the same behavioral gene, and forcing them to put their, coercing them into putting their sons on the now banned diet drug, fenfluramine. And I'm sure we're all familiar with the infamous Tuskegee syphilis trials, where 600 sharecroppers in Alabama were told they were receiving treatment for the euphemism known as bad blood, so sickle cell and other things. And about 300 of them actually had syphilis, whereas the rest of them did not, but they were being slowly injected and not treated over time. And this occurred for 40 years, from 1932 to 1972. So moving into insights and recommendations, equipment and technology for coloring X-rays and CT scans should be strongly considered in medical research to reduce the rate of medical diagnosis. The 9 surveillance areas for pneumonia should be shifted to prioritize the largest groups of minorities affected, being Black Americans, American Indian and Alaska Natives, and Hispanic and Latinos. And lastly, in order to have a successful COVID-19 or pneumonia vaccine, government officials have to include safeguards and concrete legislation against unethical, non-consensual, and non-beneficial medical practices in order to gain the participation of African Americans in clinical treatments and studies. An apology from the president or a scathing New York Times article is just not enough. There has to be measures in place. Next, I want to try my hand at pneumonia detection using an object detection model, better known as fast region based CNNs, convolutional neural networks. I would also like to perfect the de-oldify image colorization library to more closely imitate the colors of the body internally. Thank you.